Right. So if I ask you a question, a pretty simple question, which position in cricket is most taxed with injuries? What will be your answer? Fast bowlers? Yeah. So that's what typically the research says all across the world and even in India. As the graph says over here, 20% injury prevalence rate in fast bowlers compared to other positions. And that's why we need to focus on fast bowlers when it comes to prevention. And in my personal experience, I've been part of 3 under-19 World Cups, and all 3 World Cups have followed up with some cases of lumbar stress fracture injuries to our promising young fast bowlers. So it was a little bit of a personal interest for me as well to investigate and talk about this topic, right? So any approach to tackle the injury issue or injury severity issue needs to be looked at through systematic injury prevention models. And like you can see it here on the screen, Barr and colleagues and O'Brien and colleague have proposed a couple of injury prevention models here. There are multiple models, injury prevention models in the field. Most common theme is first step is to establish the injury severity, and then the second step is to identify the injury risk factors, because only then we can talk about the preventive steps. Okay. So we followed both of these steps. We did the review to understand the injury severity, and these are some of the numbers that has thrown up. As you can see here on the graph, muscle strains obviously take up most of the load when it comes to injury incidence. The white tower talks about the adult fast bowlers, the grey tower talks about the young fast bowlers. In both fast bowlers, muscle strains take the major load, but if you can see the rightmost graph, the lumbar stress fractures, young fast bowlers, injury incidences are the highest there compared to the adult fast bowlers. The difference between adult and young fast bowlers in body region specific injury distribution, if you can see the graph over here on the right hand side, the dark shades of the arrows will represent the higher number of injury incidences from body region perspective. In adult fast bowlers, hip and thigh region take most of the injuries, where in young fast bowlers, it's the lower back that that faces most of the injuries. So it is clear that in young population, investigating the causes of lower back stress fractures is an essential part, because the numbers clearly tell us that injury severity is highest in that region. So obviously the next step was to analyze the risk factors, and there are multiple risk factors associated with lower back injuries, right? As you can see here on the graph, physical attributes throw up certain risk factors, biomechanics of fast bowling will throw up certain risk factors, and physiology of fast bowlers will throw up certain risk factors. Out of these risk factors, obviously it's just a brick in the wall. We are going to talk about the risk factors inside this circle, which is the bone health and muscular imbalances. And we tackled this with a two-prong approach. Objectively, we analyzed the DEXA scans of our population, all positions, especially with the fast bowlers who were injured and had lower back injuries. And it showed up some interesting statistics to us, and which I will explain. The second approach was a subjective analysis. What we did there was we tried to understand the training history and the playing history of the fast bowlers, young fast bowlers across India, and then tried to identify if we can profile the young fast bowlers who are more susceptible to lower back pain. And I will explain these two approaches, both objective and subjective, in next few slides. So there was a theoretical basis for us to zero in on the bone health and muscular asymmetries. In the previous research, high BMI and low lean mass is a lower back injury risk factors in some of the studies. So it's obvious that body composition and subsequently DEXA scans would be a useful tool to understand. And that is different from the two common themes that has been investigated the most in lower back injury risk factors, that is either the workload management or the bowling biomechanics. These are the two areas the investigators in the past have tackled or have tried to address maximally, but no one has actually seen, or very few has actually seen, the training interventions part of it, and body composition was a good starting point there. Similarly, very recently, Alway and colleagues, he obviously is here, so he can explain it in much more detail. They have found that fast bowlers with lower back pain history exhibited greater BMD and BMC without low back pain history, I'm sorry. So it's clear that bone health parameters are going to be essential to understand which type of fast bowlers are more susceptible to low back pain. Similarly, Parrott and colleagues in their review have found out that most overuse injuries are associated with internal risk factors such as muscular asymmetries. And our DEXA scan analysis showed the similar numbers. So these are the DEXA scan reports that we looked at. Top right corner is the muscle balance report. So the the blue row will tell us the differences between the lean muscle mass in kgs between the left and right upper limb, left and right lower limb, and left and right trunk. So that's what we looked at to understand the asymmetries. And then the the bone health through the bone mass density grams per centimeter square. So that's how we looked at it. Some analysis, basic statistical analysis, basic thing, men versus women DEXA profiling. Obviously, there is a difference in bone health parameters and also in body fat percentages. 14% difference in males and females in bone parameters, both in BMD and BMC. And it obviously has repercussions not only in low back, but also especially from the nutrition and REDS perspective, which my colleague Shalini and Akanksha will speak on later in this conference. There is obviously a difference in fat percentage in male and females. More importantly, some salient DEXA profiling points for between the fast bowlers who had lower back injury in the past, specifically lumbar stress fractures, compared to the fast bowlers who were not injured. 50% of the injured fast bowlers showed lower than average squad average bone mass content, right? The bone mass density, that percentage was 70. So 70% of the lower back injured fast bowlers showed lower than overall average bone mass density, average of the overall sample size, which involved non-injured fast bowlers and other positions. Right, so there is a clear indication that bone health parameters is an essential point to understand. Lean muscle mass or muscular asymmetries, in all three cases, upper limb, lower limb, and trunk, more than 70% of the injured fast bowlers showed some level of asymmetry, especially lower or higher than sample size average asymmetry. So again, it's clear that muscular asymmetries, whether it is trunk asymmetry, lower limb or upper limb asymmetry, is going to be one of the key factors to look at. Now we all know that cricket is a unilateral sport, so asymmetry is going to be a common theme. But then if it is going to cross a certain limit, and that at this stage we don't know what number that would be, but it is still a good point to look at as one of the red flags when we talk about prevention from the training perspective. Now from the subjective point of view, we did the retrospective injury surveillance study. Can you click on that hyperlink? So we asked participants to fill up this survey. This survey is still ongoing. So we have not completed the analysis yet. But at the time of analysis, we had 65 participants who participated in the survey, and we had series of questions which asked them the specifics about their training history, the playing history, and injury history. And we got some interesting data on it. I'll try and see if it opens up, otherwise I will move on to explaining the analysis of it. Yeah, so it's just a consent form which you will click on. Just show you the series of questions. Gender, which state you play for, what age group, whether you work with a physio or a trainer, whether your height was checked regularly, and whether your SNC or a physio has asked for your parental height. This is critical because when you know the parental height, you can plot the growth chart and see which athletes are falling into which phase of peak height velocity. And that peak height velocity part is going to be crucial in understanding whether the coordination, movement coordination, and all other aspects are going to be at the risk, and what kind of workload management that you can do, right? So those are the questions that we asked. We also asked about their training history and injury history. Okay, I think then this was just an example. Because of the connection issues, we'll move on to the presentation part so that Sri will have enough time. So these are some of the numbers that we have got. Like I said, this survey is still going on. So if any one of you are interested and you know young fast bowlers, you can click on that link and fill in the survey. I can share that link with you so that you can contribute towards the investigation. So total number of participants at the time of the analysis was 65. Total injuries reported were 57. Obviously lower limb took the most of the load, 27, but 16 participants reported lower back injury, right? Only one girl out of it has reported lower back injury. It doesn't mean that girls are not susceptible to lower back pain. It's just that they are underrepresented even in the surveys at this stage. So we need to do extra to get them involved, right? From the growth monitoring perspective, this was quite interesting. All 16 participants reported that none of the physio or trainer ever asked about their parental height. So all the 16 fast bowlers who reported lower back pain were never plotted against their peak height velocity. No one has tracked their peak height velocity and see what kind of phase they are in terms of their growth. So that could be one of the factors. They got exposed to the higher workloads and got injured. The another important part was the comparison between the cricket age, playing participation age, and training age. And as you can see, non-injured bowlers had just 1 year difference between the training age and playing age, whereas the injured bowlers had 2 years lower training age compared to their playing age. And this is a critical point. If your training age is less, that means you are obviously less trained. Your physical capacities to handle the workloads and exposure of the higher level of cricket is going to be limited compared to those who are well trained. And the third important point that we found was that the multiple sports participation. That's one of the key factors, especially in Indian ecosystem where the cricket is highly competitive. So players start playing cricket at an early age and then stop playing other sports, which have a huge role to play in overall development, right? As you can see over here, lower back injuries, athletes with lower back injuries have been participating only in cricket, most of them, whereas there is more representation of multi-sport background for the players with no lower back injuries, right? So all in all, if we want to, with our limited information at this stage, from the recency perspective, if we want to profile the fast bowlers who are more susceptible to lower back injury, low bone health parameters, muscular asymmetry representation, low training age, and non-multi-sport background. If these 4 factors are present, and if it is being backed up by certain high workload or workload spikes or biomechanical factors that we already know from the previous investigations, then obviously these are the fast bowlers that we need to be looked at more carefully when it comes to lower back injuries.